So welcome everyone to this introduction session. I'm Mark Shadow-Hyam. Oops, sorry. There we go. I'm Mark Shadow-Hyam. I'm a professor in biostatistics, and I'm the director of the MSc in Health Data Analytics and Machine Learning in the Department of Epidemiology and Biostatistics. On the core, we have Joe Tide, who is our postgraduate coordinator, and Sylvia Ye, who is our postgraduate administrator. And we also have live Thomas Wright, who I'm going to let himself introduce, but just so you know, he was a former student of the course, and he was a member of the first cohort of the course. Thomas, do you want to say a few words?
Thanks, Mark. Nice to meet everyone. My name is Thomas Wright. I am the teaching fellow for the program. As Mark alluded to, I also took the program and loved it so much I couldn't stay away. I'm completing my PhD under Professor Shadow, and hopefully we'll get to work with a lot of you next year.
Thanks, Thomas. So in practice, so you have a Q&A tab where you can ask your questions. Some of them will be answered live on the chat, and some of them we will also read out at the end of the presentation, and we will address some of your questions and concerns at the end of the presentation. So briefly, why have we developed this program? So in 2018, we started developing this program and offering this because we kind of realized that there was a bit of a gap between emerging methods and advanced statistical machine learning AI approaching being developed in the field and not necessarily being used in real-world settings to address health questions. And on the other side, we also identified a gap, a knowledge gap, for people who were more on the data slash clinical slash epidemiological field, which were not necessarily familiar with powerful and important methods. So our idea was really to extend the use of these advanced machine learning, statistical, and AI approaches towards the end user in the health domain. And on the other side, trying to really make data questions available to students with a more methodological background. So that idea was really to have, by definition, a multidisciplinary culture and making two or several communities work together for the good of health data sciences. So the idea is that there's a lot of skills around the field, and having them working together is the best way, not only to exploit as much as possible the information in those emerging data, but also to make sure that there's a community building that is very literate, both in terms of data, content, complexity, and on the other side, in terms of methods. So that was really our goal when we implemented this program. So corollary to this, our target audience is really multidisciplinary. So we are including students with strong methodological backgrounds in math, stats, willing to move to an applied field. And of course, as you all know, health data is a very, very attractive and very important field nowadays. And we also wanted to attract strong students with a more applied background. So EPI students, medical students, biology, or social sciences, willing to learn on how to analyze and integrate high dimensional and complex data sets. So the way we achieve this is by recruiting a large diversity of students and making them work together. And as you will see briefly in the next slides, what we have implemented is a strongly multidisciplinary way of working. So we've got a lot of group work implemented in the program, and we make sure that these groups are very multidisciplinary. So at the end of this slide, I wrote a sentence which is can look like a joke that when we want to train expert and not nerds, and this is, although it's a bit of a pun, we really are willing to have people using more complicated and more subtle methods, not for the sake of using complicated methods, but we really want to have people with critical judgment and critical thinking on what approaches to be used to better answer research questions. So this is where we have the concept of expertise rather than nerdiness, if you want. It's not just using complicated stuff just for the sake of it. It's for a purpose, and the purpose is your research question in health sciences. So a few numbers. So as I said, the program started in 2018, where Thomas joined us, luckily for us, where we had a small cohort of 17 students with mixed scientific background. And as you can see, in 22nd iteration, we almost doubled the number of students who came from 10 different countries. Again, in 2021, a bit increase in this cohort size with 43 students, stemming from 300 eligible applications. Then we had a bit of a steady number in 21-22, with roughly 300 eligible application and 36 students recruited. 22-23, same kind of numbers. And 23-24, there was a steep increase in the number of applications, where we had 93 offers made and had a cohort size of 47 students. So across the years, we've been extremely successful in recruiting the multidisciplinary cohorts we were aspiring for, and which is also a source of pride for us. We have been able to keep our community alive within the department, because quite a few of the teachers in the course now are former students of the program. So current year's numbers are similar, but with that increasing trend. So we have received a very large number of applications, over 700 applications. And we ended up this year with 59 students. So quite a bit of an increase in the cohort size. What are the main demographics? Sorry, in our cohort, we have a vast majority of women in our course. Our 60 students come from 21 countries across the world. So we've got a large representation of Europe countries, but we also have students from Middle East, Asia, Africa, USA, and Australia. So quite diverse, and we're quite happy with that cultural mix that we were able to recruit. In terms of background, we have, as expected and as wished, a large diversity. We have students with pure math background, statistical, theoretical stats. We have people from engineering. We have some students from human sciences, of course, epidemiology students, molecular biology, and then we have more clinical students in pharmacy, medicine. So we have that large range covered. And also interesting, we have also a large range of expertise and experience in our cohort. We have students directly from a BSc. We have other students with an MSc experience. We have students with PhDs, and then we have all the students who are professional and willing to make a career change. So far, again, just reiterating, we have been able to have to recruit a multicultural cohort with multidisciplinary expertise. So that's really a key milestone that we achieved, and that we are quite happy with. So in terms of teaching organization, how does it work? So the year is organized in 3 terms. First term, which is more of a warming up term. Term 2 is more of a specialty term, and term 3 is about research projects. So the first term, as you can see, this is the illustrative schedule for this year's. You have 4.5 to 5 days of module teaching. So we've got roughly half a day of free for independent study and work. But also in these sessions, we in these free slots, we sometimes, depending on demand of the cohort, implement ad hoc additional seminars or practicals or tutorials to address a question that may have arisen from the cohort, something that was not clear or something. So we can go back on this, or during these slots, we also invite senior member of staff or senior researchers in our collaborative network to present to you, so that you've got also exposure to the research, to the real world research in the field. So more in detail, what are the main modules for that term one, which is really the building up stage? Basically, one objective of that term is that, as I said, we have a bit of a heterogeneous cohort to start with your multiplicity of backgrounds. And the idea of that term is that by the end of that term, you all speak the same language. You're able to work together and you understand each other very well. So to do this, we have two fundamental modules which are in common with other programs in the school. So that's Introduction to Statistical Thinking and Data Analysis, which are led by Verena Zuber and David Muller. Main aim of this module is that you understand statistics for epi. So these are the key concepts that we are playing around with when we're doing epidemiology. That module may appear as a kind of a refresher for the students with more of a methodological background, and more of a learning module for students with more of a clinical background. But this is important for both, because more methodological students will see it in a more applied way, and that kind of helps you changing perspective in the concepts tackled in the module. Then we have a second module on principle and methods for epidemiology. So that's led by Philippos Philippidis and Amanda Cross. So again, here is an introduction to the main methods, design and concept that we play around with in epidemiology. So that it kind of is a bit of the counterpart of the stats module, may appear for more applied student as a refresher, and maybe a bit more new to more theoretical students. But again, it's another way of looking at it and viewing it. So there's always place to learn it or relearn a few concepts that are very important for term two. Then we have a module called Clinical Data Management, led by Thomas and Lucas Cheng. In this module, you will learn how to design a database, how to securely and ethically maintain it and query it. So that's very important module, where you get to know what are the specifics of working with clinical data, and what important aspects you need to keep in mind when you work with this kind of data. Then we have another module, which is important for term two, on molecular epidemiology, led by Professor Degem. So that's really introducing you to omics data and molecular data. And you will see in that module, what are the different types of omics that you could have, what are the specifics, and what are they useful for. So that's important preliminary module, because in term two, you will see that most of the methods that you're going to learn are going to be applied to omics data, which is a very good example, because these are complex, high-dimensional and multi-block data that are defining a methodological constraint that we are learning and that we are teaching in term two. So this module is key for you to get acquainted to the data that we're gonna that justifies the methods that you're gonna be taught in term two, pretty much. Then we have a final module called Translational Data Sciences. So that module is happening every other week, and it's split in two parts, one part in term one and one part in term two. So this module is led by Sabrina Rodriguez, who's on maternity leave for the moment. So you will have another lecturer of ours leading that module. and Verena Zupa. The idea of the first part of translational data sciences in term one is that we show you the practical aspect of conducting rigorous, transparent, and reproducible research. So the idea is that you're able to code properly, you're able to code in a manner that makes your codes reusable by anyone, and your results being able to be reproduced exactly. So all these essential requirements for publishing research and for doing good research are going to be taught to you in term one, in that first part of the module. Then we have in term two, the specialty modules, where you will be taught 3 to 4 days per week. And typically a week is articulated on the Monday. You've got one module, which is a new module this year that was extended to be 10 weeks, sorry. Then you will have a Tuesday dedicated to machine learning. Then the Wednesdays is independent studies for the first week. And then you've got a series of seminar in the last 5 weeks of the modules. Thursdays is Compepi, and then on the Fridays, you've got every other week, the second part of the translational data sciences. Of note, the research projects that are starting in term three are allocated during term one. So in more detail, what are the 4 modules for term two? So Bayesian analytics are led by Professor Biangiardo and Monica Pirani. In this module, you will be introduced to Bayesian modeling to perform time series, hierarchical, spatial temporal, and disease modeling. So that's really an overview of the utility of Bayesian statistics and Bayesian modeling to capture complex data sets and model complex correlation structure. So either through time series and or spatial temporal modeling. So that's an important module. Then you have the machine learning module led by Dragana Vukovic, where you will be introduced to machine learning methods, calculations, and interpretation. Then you have a companion module, which is computational epi, which is led by myself, where basically same approach, but you're looking more into statistics for large data profiling and integration. So we're taking example, as I said, of omics data, but this applies to any kind of complex and high-dimensional data. And then you've got the second part of the translational data science, where you will apply all the models that you're learning in these 3 first modules on real data. So you'll be allocated a research project from data scraping to paper writing. You will have a real research question, which is something that has not been published on, and you will conduct the research according to the principle that you've learned in term one for transparent, reproducible research, and applying the methods you will have learned in those 3 modules to your data. So just a side note, quite a few of these projects have converted into draft papers that are being submitted as we speak last year. So this is real research pieces, and that's real exposure to real world research in groups. And then and then term 3 is about the research project. So there's a big emphasis across the program on project work. So you have different types of projects. So you've got project within modules. So for instance, in a lecture, you may have a small project using toy example dataset that will help you have a practical exposure to the methodological concepts you've been taught. This is supervised by tutors during the practical sessions, and some of them are evaluated through presentation and or reports. Then you've got the translational research project, which I just alluded to, which is, again, a group work using real data with a real and unexplored research question. You have a data expert, some tutors and module contributors that will supervise you and drive you through the process of that research development. And that will be, again, evaluated through a report and a oral presentation. And finally, you have the individual research project in term 3, where this is individual work. Again, real data sets with real research question, supervision by data expert and methods experts. And this is evaluated in September by an oral presentation and a written report. Yeah, so we have a large range of project types. So for instance, within module project, you have real data coming from the research projects we're involved in within the department and within the school. And abroad, we have also external collaborators contributing to these group projects, including for TDS, where you have real data across the school, across departments, with other universities and so on. And for the research projects, we have a very large portfolios of project to offer. So they come from the school, they come from Imperial in general, from other universities, from industries as well. And there's, because I know there's going to be a question on this, those research projects could also be student-led. So if you have a subject you're particularly interested in, you can tell us this. We will make sure that you will work in the field. Maybe sometimes it happens that you even know with whom you want to work. So we will go through it with you, look at the research proposal, make sure that it ticks all the boxes and all the learning outcomes that we're expecting for the course. We will sign off on the project, and we'll have an Imperial supervisor just to make sure that everything goes according to plan and that the project runs smoothly. But there's many options for the project. And again, these research projects usually yield publication by the students. So here I'm just listing a very non-exhaustive list of projects that have happened in the past year. So of course, there was a lot of project on COVID, risk of COVID, long COVID, and so on and so forth. There was a lot of project on molecular phenotyping of chronic conditions like cancer, asthma, CVD, mental health, and so on. There's quite a few projects on population health, on exposure modeling, on characterizing responses of hospitals to crisis, and so on. There was also a few projects on infectious disease modeling. There were more methodological projects in machine learning to develop interpretable and reproducible ML approaches and how to use that in practice. Quite a few projects on image processing, on simulation tools, data analysis, quite a few projects in prediction. And then there was a lot of industry-based projects. So I'm listing here just a few sets of companies with whom we regularly work. So as you can see, there's big companies like big farmers and so on, but also banks. We also have collaboration with smaller startups. So there's a very large diversity of collaborators with whom we can generate some research project for you to spend your last term on. And again, as I just mentioned, there's also opportunities for you to design your bespoke project, provided that it ticks the boxes of the learning outcomes of the program. Just as a final note, this is the overall structure of the program, but there's also some additional resources. We offer, especially in term 1, some optional but recommended teaching so that you're up to speed on a few important aspects like linear algebra or a bit of a math refresher. There's also an introduction or a refresher on cellular and molecular biology so that you kind of start with the common knowledge in your pocket. And then there's a few sessions on programming. So there's one on Python and there's one in R that are also organized at the very beginning of the program so that you feel more comfortable. There is a lot of seminars offered during the year. So these are the school seminar, but also course-specific seminars, which are important opportunities for you to learn how health data analytics happens in practice and in the real world. You will have the opportunity to meet very important and international experts in the field of health data analytics. So not only that's a way to learn more about why, how what you're just learning is useful in the real world, but also it's a great opportunity for you to network a bit and to seek opportunities for future collaboration. So with that, I will close the presentation and I will open the floor for any questions you may have.
All right, we have a few questions in the chat. So first of all, lots of the modules are about epidemiology. Is this more focused on disease transmission, for example, epidemics and pandemics, or is it about diseases such as cancer or neurological disorders, etc.?
So it's a good point. So there's disease modeling as an epidemic modeling is not an essential part of the program. It is taught in the Bayesian module in term two, but what we're really working on and the main focus of the program is really about the methods for, I would say, chronic diseases. So a lot on cancer, a lot on cardiovascular and so on. But it's all about methods looking at the influence of risk factors, risk predictors, including the environment, to the risk of chronic diseases mainly. But there are some courses and some methods that are, of course, very relevant for disease modeling and dynamic modeling.
Wonderful. So for the next question, we have a question that is, do you recommend that candidates are already skilled in Python when prior to when class starts?
No, so that's a question we always get. Everything you need to know will be taught during the course. So you can be a total rookie in Python. So of course, if you're an expert, some of the stuff is going to be quicker for you. We have the structures in place to make sure that you know exactly what you need to know before starting the modules. So these are the optional sessions I was referring to. There is also some pre-course reading materials that are optional, but that you can dive into if you want, and if you feel more comfortable to start the module with that. But no, there's no prerequisite for in terms of technical skills.
Mm. Yeah, I always think that's one of the great things about the program is that we welcome such a wide range of skill sets and give everyone the opportunity to level up. So does radiology image prediction, for example, using MRIs, could that also be the kind of a project that a student
Yeah,
could?
we've had a lot of a project on an MRI or any medical images analysis. We've got a lot of them. So in relation to cognition, in relation to cancer and so on. So there's a lot of it.
Yeah, and just as a little note, I did my summer project using MRI images to measure motility. Okay, so I have seen a couple of alumni who are doing internships starting in August. Is this one of the program or is this one of the project that has been done for a company?
No, so that's a good question. So this is so the one point that I just want to clarify. This is a full-time project, and it is quite intense. So the three terms are quite intense, particularly term two is very dense because there's a lot of project work, a lot of new concepts to learn, and so on. And term three is a full-time research project. In very few exceptions, some students were awarded independently because they applied and they got it. Some of them were in the scope of a research project. So, for instance, I think there was an internship in AZ, if I remember correctly. So they got that opportunity. We had a very thorough evaluation of whether it was feasible or not, but it was a great opportunity. So that's not part. So just to answer quickly, this is not part of the project and part of the program. But when a great opportunity happens to the student, it's a shame not to let them benefit from it. So we made sure that the student could finish in good condition, and with that in mind, these internships were accepted by the course. But this is really exceptional. Well, if you look at the numbers, it's just a handful over 300 students. So that's a minority.
Um, yeah. And so the next question is the program's focus more in learning different machine learning models or the application of models in health subjects?
It's about learning relevant approaches to analyze a research question. And it's also about developing critical thinking. So it's not about learning the method just for the sake of learning the methods. Is at the end of the course, you know a portfolio of methods that you could apply in different conditions, but more importantly, you are able to formulate a research questions in methodological terms. So you would be able to go out in the methodological literature and identify new methods that you've not seen in the course that could do the job that you're asking it for to do. So you will be able to make that exercise of formulating the question in methodological terms and identify the constraints and the challenges that you have with your data and with your question. And then you will also be able to read carefully the methods paper that you would have identified in the literature and pick among those the methods that could be a good match to your question. And importantly, you will also be able to interpret the data correctly and rigorously, and you'll be able to also assess the quality of the results and compare them across the methods.
Yeah, and just from, I guess, a student's perspective, something I very much enjoyed is that there's a lot of practical hands-on work. And so it's not just introducing models, it's making sure you can actually do things. That's being the expert and not the nerd. So what type of jobs can this master help us achieve? My background is in engineering, so I haven't checked many health data related jobs.
So again, it's going to be a bit of a non-answer in the sense that there's a very large diversity of outcome after the course. What I can tell you is that our students are very employable. And the moment they get out of the course, they pretty much get a job and pretty much get the job they wanted. So it really is up to the students and up to their appetite. But we have quite a few students continuing in research in academia, doing PhDs. We have I don't have the precise numbers yet, but there's a bit of a fraction of our cohorts that go on to do a PhD. We have students that go into big companies, big pharma, big industries, banks, whatever, to do data science. We have students going to NGOs, going to smaller companies, building their own startups. It's very, very, very. It's just an open world, I would say.
Um, Yeah, and just to add on to that, Imperial has wonderful career services, and so you will be learning a lot of really valuable, sought after, translatable skills and methods, and content specific knowledge. And the career services can help you figure out what careers are out there that would link up with those skills that you might enjoy. And that is available for you not only while you're a student, but for 3 years after. So there's a lot of things in place to help you figure that question out. So for the next question is, I don't have any background in computer science. I am a core bio student. Do you think I will get benefited from this course to be placed? I think that means, do you think it would be beneficial for them to take this course?
Absolutely. We've got a lot of students with zero quantitative background joining the course, and some of them become at the end of the course the most proficient and very good coders. We've got good examples of medical students or biological students who had not done any quantitative analysis before, and they end up being proper computer people. And some of them continue their career more on the computer side or on the analytical side than in the biology side. So definitely, yes.
Yeah, and again, just a little personal perspective. From my cohort, I had a friend, Emmy, who came in as a biology major straight from undergraduate, and she is now a data scientist at one of the top 4 consulting firms, who's coding all the time and doing great. So don't let a lack of knowledge stop you from applying. Um, is it appropriate to mention persons that you're interested in working with in the personal statement?
Absolutely. But make sure these person are people that we because sometimes pick the right person, pick the person that is in the school or that is linked to the course. Yeah.
Right. Yes, we cannot connect you with absolutely everyone in the world, but we do have a very far reach if we for who we can connect you with. Okay, so this is another career-based one. So what typical careers do most alumni tend to apply to after graduating, i.e. data science, both within and outside of healthcare, finance, etc.?
Well, I think we addressed that question. It's very wide, and it's really all possible domains. I mean, we could not list it, but there's a large fraction staying in house domain, so pharma, research, biology, and so on and so forth. But go banking, agriculture, all of it.
Exactly. You know, healthcare is a wonderful evergreen field that there will always be jobs for you in. But the translationable skills are able to be applied anywhere. James just got hired on at the CFA to do research into AI applications in finance, for example. Okay, this is another one. So I think we've already covered it, but what roles or industries do you see graduates go into? You know, research, academia, dev sector, or tech. And Mark, you've already mentioned it's a lot of academia and research, but it's also, you know, as you mentioning, it's just a broad range of possible careers. Is there anything else you'd like to mention on that?
No.
Okay, so the next one is, could you give some more information on how the student got the AZ internship? That's AstraZeneca for those who don't know.
I think there was an open, well, honestly, I'm speaking just from memory. I think the student applied, there was an internal competition, and the student got it. So it was offered. So we tried to see if it was possible to postpone it after the end of the research project. It was not possible. We had discussions with AZ, and we kind of found an arrangement to make sure that everything could be finished in time or a bit delayed, but that the students would not be overwhelmed, would be able to make the most of the internship and also carry out an excellent research project. So we didn't want it to cannibalize because these internships are important and good resources and good experiences, but they need to be quite independent from the research project itself. So yeah, anyway, so it was internal competition that the students applied for, which is not something we usually recommend because, as I said, these research projects are full-time projects. They're intense, and the more intense they are, the funnier they are, and the more productive they are.
Mm. Yeah, and I guess just broadly, how did they get it? By being part of our program. Because it will
Yeah.
I always say that it will get you lots and lots of interviews, and doing well in the program will then get you the offer. So if we come from a relevant MSc background, such as epidemiology, do we have the option of taking other modules during the time of the modules that we I think that one just got handled by Sylvia, actually. So I'll leave that one in there. It's in the answered Q&A. Sorry, it's just disappeared from the chat. So here we go. I am coming from a medical background, but I haven't worked for the last 5 years and become a full-time mother of 3. Is this gap year of mine a problem for the application?
Absolutely not. Absolutely not.
Yeah,
You're
exactly.
welcome to, I mean, I'm a bit short, but you should not refrain from applying. And having a course can be a good way back into working. So first,
Oh.
that's not going to be we're not going to well basically apply. That's the quick answer. Apply.
Hmm. Yes, and again, you know, we welcome people from all backgrounds. It really makes for a very vibrant, dynamic course. So don't think that your background doesn't fit what we're looking for. What kind of quality experience do you expect from a successful applicant?
So successful applicants. So it's a very competitive course, as you've seen with the numbers. So what makes a good application is, of course, excellence. So you need to have a good background. If you have experience, and if you're doing a career break or this kind of stuff, it's also good to look at the professional experience. So one point is really excellence, and the second point is really about convincing us that HDA is going to make a difference in your life. So it's going to help you constructing and building a milestone that you need to go where you want to go. So if we're convinced of that and that you're excellent, then you get a seat, pretty much.
Mm. Oh, great advice from the person who reviews the applications. So I think this might be the last. Oh, no, we have a few more. This is a great question. I see that the coverage is far and wide in terms of applications, but what's an example of a profile of a candidate or some motivation that you think might not be a good fit for the program? So who's someone that you do not want to be applying to the program?
Well, it's difficult to say that, but an application that just tells me, oh, I love health, I love AI, I want to do AI in health, that's not an application that is informative. I mean, this is not an AI course. This is a course that helps you understanding health data issues, health data research questions, and methods to address them. So should they belong to AI? Should they? So any application with a gazillion buzzwords is not really appealing.
Yeah. And that's great general life advice. Don't overload people with buzzwords. Have something you actually want to tell someone. Is there any opportunity to take extra seminars or use resources provided by other Imperial schools, such as the School of Engineering or Computing?
Well, you have access to any seminar, but you won't have, well, in practice, yes, but again, this is a quite intense course. So free time is not huge, but you have access to all the Imperial experience. That includes a seminar from other departments and so on.
And again, from a student perspective, when I took the program, I regularly attended events put on by the Data Science School, the School of Business, and other programs at Imperial for seminars, hands-on practicals, and other such things. But as Mark said, it's a very demanding course, but there's still lots of things at Imperial for you to draw on. And I believe this might be the last question coming up. Oh, sorry, just got another one in. I come from a data science and machine learning background, and I notice there seems to be a strong emphasis on epidemiology and statistical analysis, but I think my interest is more in the practical application of machine learning methods. Would I still gain great value from this course?
I think so. You've got the entire term two, which is really about that. So you will know already the algorithms, but you will learn why some are popular, why some are used, what are the strength and limitation of this and that model, and you will also be able not to use what exists, but to fine tune some models and to come up with your own ideas of developing a more appropriate approach for a certain question. So I think so. You will learn a lot.
Yeah,
It's also about interpretation and about also translating the results in an interpreted way so that people not from the field can understand and can make something of it.
Yeah, which is a massive point. And again, Mark mentioned earlier that you learn how to actually conduct science and to examine questions in a rigorous way. And that's a big difference between a data scientist and a data analyst. And so that's the type of thing that you would learn here in the program. So by when do students usually formulate their research project? Is it advised to have one as part of their application?
No, 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 no. Well, you can if you want, but that's not what we're expecting at all. What we usually do is we have some of our students are very driven and they know exactly what they want to do. So they come induction week, first week, they come and talk to me directly and say, oh, I want to do this during the summer. Some may, which is a good idea, but sometimes it's also good just to let it mature a bit because you're going to learn new stuff. So it may also be that this year is a good opportunity just to go a bit outside of your comfort zone or outside of your anticipated needs or envy. But yeah, it can come at or sometimes you have students that are interested by pretty much everything and they're waiting for portfolio that we publish in end of term 1, beginning of term 2, so that they can start have an idea of where they want to spend their next 4 months on. So that's quite flexible, but no need to do that in the application.
A follow-up question on that from me. What if I don't have an idea for a project? Is that going to stop me in the program? Do I need to come up with my own one?
Absolutely not. We will propose you a lot of them, and if you don't find a good project, we can discuss together and try to fine tune some and make sure that we have access to a lot of data, a lot of collaborators. And we've never been in a situation where a student was doing a project he or she didn't like.
Yeah, exactly. So don't feel like you need to have it all figured out before you get here. That's a big part of what you do in the program.
And there's
Okay.
a few examples where we had very driven students coming, say, I want to work on that field. This is what I want to do. And then a couple of months later, said, well, maybe I'm going to change. And they went to something else because they noticed they learned new stuff that we're interested in and made the most of the year and just do something totally different.
Hmm. Um, all right. And then so does the course equip you with a sufficient base in epidemiology if this is the route you want to pursue afterwards?
Yeah. Well, it depends because, well, it's a bit of a tricky question. You're doing a lot of it, epi for sure. We also have a program in epi. What you do here is, I think you get into more modern epi, where you're not shy in using more advanced techniques that are getting used widely in the epi field, but you go a bit beyond the classical epidemiological thinking and modeling. So I think it kind of, in a way, embeds what you need to know in epi, but you've got the extra card of going a bit further in terms of methods.
Hmm. Yeah, not everyone who works in an epidemiology group has identical skill sets. You could bring something new that you would learn here. Okay, a smaller, easier question. What programming languages are covered in the MSc?
So you are mainly R and Python. So we're reinforcing Python based on student feedback. And you will also see a bit of a SQL for databases, and that's pretty much it.
Yeah. You will do a tiny amount of Unix and Bash scripting, but that is very tiny. Okay, how many contact hours will we roughly have per day? Lectures, seminars, etc.
So a typical day is 2 to 3 hours lectures in the morning, sometimes an hour seminar around lunch break, and then the afternoon is 3 to 4, I'd say 2 to 4 hours practicals.
Yeah. It's full days. That's something to keep in mind, is that it's full days on campus and participating is a big part of the program. I would like to meet and discuss with some bioinformatics teams I previously worked with to discuss if this route is right for me in the coming weeks. I wonder, however, if this will hinder my application if I delay submitting it until December/January. Do you fill up the course prior to the application deadline?
Good question. We're trying not to, but this is a very popular course. And so we're always struggling. So if you're interested, January is not a problem. We still have room and there's still seats available. But if you're really interested, I would recommend that you apply uh, at the latest in spring. I mean, it becomes a bit tricky after that.
Hmm. Are you based primarily in the White City or Hammersmith campus?
White City.
And for those of you that don't know London, they're about 10 minutes away from each other. We also have the South Can campus and a few other ones, but we are primarily at the White City. Um,
In a brand new building.
yes, in a brand new, beautiful building. And then the last question, somewhat fitting. what is the written exam format? Is it open book?
It depends. It depends. To be honest, it's usually better to have closed book exams because open book is the best way for you to get distracted and lose time. But it depends on from one module to the other.
Yeah. And while assessments are incredibly important and we want you all to do well all the time, don't lose sight, it's the knowledge that you need. How do you view applicants who had some global data science, AI, computing certifications, but lack professional experience in those roles? Are certifications considered strong indicators of potential, or is the professional experience more heavily weighed even without certifications?
There's no common rule. I mean, you don't need to have professional experience. You just need to have a background. Well, basically, just need, as I said before, you just need to show that you're excellent and that you're really willing to do the course for good reasons. That's really what you need to do.
And I guess again, a bit of personal information. My background is in economics and finance, and I had no professional experience in data science or any of those things you mentioned, but I did certifications, and so it's a great way to prepare yourself. Okay, if I apply close to the deadline, is there any chance of being accepted?
Uh, very, very little. I mean, we're struggling with Joe, Sylvia to fit everyone towards the end of the application period. And sometimes we have to close it earlier.
Hmm.
Again,
So applying.
apply before spring is usually a safe bet.
Hmm. Would you say generally better is sooner? Sooner is
Of
better?
course, yeah.
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 Okay. That is the end of our open Q&A questions. Thank you for everyone for asking them. Is there anything else you'd like to say, Mark?
No, just feel free to apply and contact us if you have any question. And looking forward to see you next year.